Mrs. Princey, Associate Professor in Mental Health Nursing. You know that our mood is congruent with the environment. Sometimes when the weather or when the environment is very dull, right? When the weather is very dull, very cloudy, okay, even our mood goes low, right? So we can say that there is an influence of the weather or the environment on our mood. Okay, one such conditions wherein the person will have a very low mood in the different situations. One such example is the seasonal affective disorder. Based on the season, the mood of the person is affected. Right? So we have got a therapy for treating such kind of a seasonal affective disorder, or we can say even the person may have problem with the sleep-wake cycle, circadian rhythm problem. Right? So for such kind of a people, we have got a therapy for the treatment which is called as the light therapy. So today I'm going to talk about the light therapy or the phototherapy. Light therapy or phototherapy is a treatment process which can be used for an individual with the seasonal affective. It is called as SAD, which is a non-psychotic kind of the depression, specially experienced by the person during the winter season. SAD or the seasonal affective disorder is a cyclic illness, especially which is seen during the winter season. There is a fall in the mood, or we can say low mood, but the mood remits back during the spring or during the summer season. If you take the epidemiology or the prevalence of such kind of a disorders, seasonal affective disorder, it is based on the latitude of the person, the age and the sex. You're going to see the prevalence. So it's especially seen in the people who are living in the higher latitude. And if you take the age group, it's especially seen in the younger person compared to the and the gender. Right? So usually it is seen in the women, that is about 60 to 90% of this illness can be noted in the women. Right? This is the prevalence of the seasonal affective disorder. So what is done in the light therapy or the phototherapy? They make use of the artificial lighting that is brighter than the usual sunlight or the indoor lighting to a particular environment of the individual who is experiencing the seasonal affective disorder. So it is found that if this light therapy is given, about 75% of the symptoms can be controlled just by exposing the client to this artificial lighting. So let us see the meaning of the light therapy. It consists of exposing the client to the artificial therapeutic lighting, which is about 5 to 20 minutes brighter than the outdoor lighting. Lights with the broad spectrum fluorescent bulbs have been designed to produce the intensity and color of outdoor day lighting. So people or the persons with the the person with the SAD or seasonal affective disorder can simply sit at home and get exposed to these artificial lights, and they can engage in their own usual activities like reading, writing, eating and so on. We've also got a newer light resource or the light source which can be helpful for these kind of the clients, which is the device called as a light visor or light goggle, which the person can wear about his head. Okay, so that is a newer device which is used in the light therapy sessions. Moving on to the uses of the light therapy, it's definitely used in the person who are affected with the seasonal affective disorder, who's feeling very down, having less energy and difficulty to get up early in the morning. It is used in person who becomes less productive and thinks that life has gone in extreme. It also is used in people who has got the increased appetite as well as the weight gain. It is also indicated in the women who are suffering with the post-menstrual syndrome, So these are the various uses, or we can say the indications of the light therapy. Moving on to the process of the light therapy, it includes simply sitting close to the light box with the lights on and the eyes closed. So in this, the person is free to do his routine activities like writing, reading, eating his meals, and so on. The session lasts for about 15 minutes to 2 hours, which is separated by into sessions depending upon the need of the client. In this light therapy, the amount and the duration of the light can be adjusted. Moving on to the mechanism of action, the exact mechanism is not known, but it is found that the blood levels of the hormone melatonin, which is very high in some cases, can be brought down to a lower level when the client is exposed to the light therapy. So with this bright light therapy, the internal clock of a person in a body can be controlled, can be managed, wherein it is going to have an impact or a control on the daily activities, sleep-wake cycle, as well as the bodily activities. So that is about the mechanism of action. Moving on to the time to use light therapy. Apart from the seasonal affective disorder, people who are having the sleep problems can also use the light therapy. And research has found that light therapy, the time of using the light therapy is most beneficial when it is used in the evening rather than in the morning. So that is the best time to use the light therapy. Moving on to the indications, as I told you, it is specially indicated in the people who are having the seasonal affective disorder. So it comes under the group of mood and sleep related disorders. So number one, we have got the SAD, seasonal affective disorder. Then we have got non-seasonal depression, major depressive disorder, bipolar disorders, postpartum depression. The second indication is chronic circadian rhythm sleep disorder. So in these conditions, the person who is having a problem with the sleep, like delayed sleep phase disorder, non-24-hour sleep-wake disorder, sleep disorders in Parkinsonian disease, sleep disorders in Alzheimer's disease, situational chronic circadian rhythm sleep disorders, which is termed as the shift work sleep disorders, and also for jet lag. So these light therapy can be used in such kind of a sleep disorder, especially in the people who are not having a fixed work timings. Okay, they have a frequent shift in the work timings. Even in those people, the circadian rhythm will be disturbed. So light therapy is definitely going to help such kind of the individuals. So that is about the indications of the light therapy. Moving on to the contraindications. So what are the contraindications of light therapy? In case of glaucoma, in case of cataract, and also in people who are using photosensitizing medications. What are the side effects of the light therapy? It has got a very minimal side effect, but the side effects can be related to the eye, like it can cause the eye irritation, redness elevated by sitting farther to the light source, nausea and agitation when you begin the client on the treatment, but this nausea and agitation just passes off as one gets accommodated to the therapy session. Apart from that, we have got the side effect of the headache. Now, what are the precautions that you have to take when you plan for a light therapy? You have to take the special precautions in patients who are having the problems with the eye, like they may have any kind of the eye disorders like glaucoma, cataract, who are taking the photosensitizing medications, people who are experiencing the headache, dry eyes, mild kind of a sunburn or fatigue. So these kind of the problems can usually be relieved by adjusting the length of the light therapy or the light treatment, and also by using the sunscreen lotions or some kind of a nose or the eye drops for the eye irritation or dryness of the eye. So those are the special precautions that you need to take when the client is on the light therapy. Now moving on to the aftercare, there is no fixed aftercare procedure, but it is recommended that the client takes some minutes to just rest. So this rest is not only going to give him a relaxation, but also it is going to improvise, or the effect of the light therapy can be benefited when the client will rest after the light therapy. Moving on to the advantages of light therapy. One of the advantages is the client can just move about wherever he wants to when the client is receiving the treatment. Another advantage is the amount of light required for the treatment for the remission will vary depending upon the individual and depending upon the intensity of the light the individual gets. You can also note that there is a positive effect that can be noted within 1 week of treatment with the light therapy in the patients with the seasonal affective disorders. Another important advantage is going to provide the brighter outdoor lighting to the person who is living in the dark winter climates. It is really going to help out the client in case if the client is having a problem with the skin disorders, right? Like psoriasis, the light therapy is going to help out the client with skin disorders, and not only that, even the mood of the client can be elevated in the individuals with the mood disorders. It is also going to bring about a heightened energy in the activity level, and it's going to relieve all the negative thoughts of the person or the preoccupation of the person, especially in case of the depressed individuals who are having these symptoms of negative thoughts. It also found that the light therapy can be combined with the antidepressants, which is going to really help out the client in relieving the symptoms in the seasonal affective disorders. So these are the various advantages that you can note in the light therapy. Moving on to the nurse's role. What is the role of the nurse? Number one, assess the need of the client for doing any kind of the activity. So if the client wants to perform the activity, you need to find out what is the need. Is it really needed that the client must read a particular thing or perform a particular act during the light therapy session? So based on that, you can give the freedom for the client to perform the activity. Next thing is you ask the client what he wants. So even though he is there under the light therapy sessions, if the client requires anything, any help, you should be able to be there present to communicate, to find out what he needs. Assess the mood and activity level of the client before and after the light therapy. So the activity level should be elevated to such an extent that the client should have an improvement in his condition, and not go down. Encourage the client to participate in the activities. It can be reading, writing, or eating, or so on. You can just encourage the client to perform the activities, not just limit. At least you can ask the client to just move about when he's there under the light therapy session. Teach the client, give the education to the client. What is the light therapy? What are the activities that he can do when he's under the light therapy? Okay, all the education that you can give. And also see to it that you have set the proper environment for the client to receive the light therapy. Moving on to the client education. What are the educations that you can give to a client who is receiving the light therapy? Number one, advise the client to use the relaxation technique. So even the client is exposed, you can ask the client to perform the various relaxation techniques. Can be breathing exercises, meditation, yoga, all these that he can perform. It's not only going to give him a light source, but also he can be relieved from all this tension and stress when he does the relaxation techniques. Educate the client to undergo the light therapy sessions on a regular basis so that his mood can be elevated and he can have a balanced sleep during the night. Teach the client that these light therapy sessions are really going to help out the client in certain psychiatric related problems, especially to elevate the mood, and it's also especially going to help in some kind of a sleep problem disorders or the skin disorders. So give them the education about the light therapy, the uses, indications, or what are the side effects that can happen, or how to have the precautions done to protect themselves from the light source, like applying sunscreen lotions, or nose or eye drops, right? So which is going to reduce the side effects of the light therapy. So this light therapy is specially used for elevating the mood of the client in the seasonal affective disorders. Along with the antidepressants, we can also ask the client to undergo the light therapy sessions. Hope you all have understood the topic.